Helping patients with their mental health is crucial to many medical challenges and treatments. Our team from Phillips County Health System shows us how a career in behavioral health uses empathy and insight to help at-risk and in-crisis individuals navigate a path to mental health wellness.
Phillips County Health Systems understands that now more than ever it is important to pay attention to mental health, fostering hope and healing in their patients. Mental health care specialists find joy in their profession. Let's take a closer look at what some of these jobs involve. We'll start by introducing Carmel Engelkey.
I'm Carmen Engelkey. I'm an LSCSW here. I got my education through Fort Hays State for my bachelor's, and then I got my master's through the KU Advanced Standing Program. I've worked here at Phillips County Medical Clinic for almost 6 years now. I work with children and adults ages 5 and up. I do play therapy, cognitive behavioral therapy, amongst other therapeutic modalities. So I come in the mornings, and that's kind of for an hour I get to just kind of start my day. Every social worker has to have their cup of coffee first thing in the morning, and then I get an hour just to do some documentation. And then I start seeing clients or patients at 9 a.m. and I see each client for roughly an hour. And then, so I see roughly 7 to 8 patients a day. And I get to spend an hour with them doing therapy, listening to kind of what's been going on in their lives, trying to figure out treatment plans or how I can best serve those clients, and help them through whatever challenges or difficulties they're going through. I also work very closely with the other providers here, so if there's a patient in to see one of the providers and they're struggling with something too, I can pop into the exam room and do what we call a brief intervention, offering them counseling or offering them some solutions to help solve whatever they're going through.
Another rewarding profession in mental health includes helping seniors navigate the difficulties that go with aging. Cassie Seaman, who is the program therapist of Senior Life Solutions, tells us more.
My name is Cassie Seaman, and I am the program therapist for Senior Life Solutions here at Phillips County Hospital. Senior Life Solutions is an intensive outpatient program where we are uniquely designed to meet the needs of seniors age 65 and older. We are able to provide group therapy here on site at the hospital. We're also able to provide individual therapy, and we are overseen by a psychiatrist who meets with our patients once monthly. Our group topics focus on a range of things, including takeaways, psychoeducational information, just helping give patients something that is tangible that they can take into their everyday life to help them promote and enhance their mental, emotional health, as well as their relationships both inside the group and outside of the group. We think what is unique about our program is we really take a multidisciplinary and collaborative approach, working with patients' physicians, their family. We also have RN that's on our staff, our program director, Ashley Delaney, as well as an office and patient coordinator, Claudette Graham, who helps assist the patients every day with setting up their transportation needs, overseeing any medication needs or changes. We take patient vital signs, blood pressures to help monitor and engage any changes that might be going on with them physically, so that we can help address and be proactive and working with their physician to manage those needs as well.
Sometimes healthcare professionals evolve into new opportunities and passions, which is the case with Robin Burwell, the psychiatric mental health nurse practitioner at PCHS.
I started as a nurse many years ago, and then desired something more, so went back and got my family nurse practitioner degree, and then 2-3 years ago went back and furthered my education and went into mental health and psychiatry. So, and I've always wanted to be a nurse. I'm not really sure what else I would have been. So usually it's trying to get like paperwork done that's left over from the day before, and then also just returning phone calls, answering questions for my nurse, and then we start in seeing patients. So, and then it's patients all morning until noon, and then you have a little bit of time for lunch, and back seeing patients at 1 o'clock in the afternoon until 5. And then you do whatever paperwork is left over then. So usually get home 5:30, 6 o'clock usually. My piece is more of medication management. So they come in and talk with me about what's been going on in their life, and we try to come up with like a diagnosis for what they're going through. And then we decide treatment plans together. So it's looking at, would maybe you benefit from more counseling versus actually medications. And so then we would refer on to Carmen, and then if we decide to do medications, then we have them come back and see me until we get them kind of evened out a little bit.
Overall, when working in the mental health field, you get to directly contribute to positive changes in people's lives. That satisfaction that comes from this type of career makes this more than just a job. It's fulfilling and impactful.
I want to welcome our panel of behavioral health experts to answer questions about the career opportunities in behavioral health. Joining us this morning from Phillips County Health System in Phillipsburg is Robin Burwell, Cassie Seaman, and Carmel Engelke. Good morning.
Good morning. Morning.
Carmen, my first question is for you. Do you have, in your position, and you might remind us what your position is, do you have to deal with body and bodily fluids?
I am a licensed specialist clinical social worker, so bachelor's in social work, and then moving on to your master's, and then your clinical license is some supervision over the course of like 2 years. And the answer to that is not typically. Most of the time we don't have to deal with that. There's always a little bit of a chance somebody might get sick or we get a paper cut, maybe, but no, luckily not typically.
So these are fields, if a student is watching and they're not interested in dealing with the blood side of healthcare, behavioral health might be a good path for them.
Yeah.
For each of you, I wanted to ask you, how do you stay motivated? When you're working with hard and challenging cases, how do you stay motivated in your job? And each one of you can answer that.
Sure. So I think we educate our clients on knowing that progress isn't always going to be linear in your life. So every day isn't guaranteed to be better than the day before. So I try to keep that in mind for myself. I also try to practice good self-care, good self-awareness, so that if we are dealing with a particularly difficult case or a difficult client, that you kind of have tools to help you work through that and stay motivated. Also leaning on your coworkers for support. Your support is important.
Definitely. Yeah, I kind of just piggyback on what Cassie said. I think, knowing that things aren't going to be good every day for the patient and trying to educate them on that. And then I think too, we went into healthcare for helping patients. So our goal is to get them to be the best that they can be, the best that they want to be. And that kind of is what keeps me motivated. So.
Yeah, I agree with everything they've said. Self-care is a huge thing for me, making sure that I'm getting that, getting my cup refilled each evening or on the weekends so that I can come in and be my best self for my clients. Relying on also both of these two for support too. When I'm having challenging cases, I contact them, consult with them, ask for advice, other opinions. And I think also kind of reminding myself too, like I'm only a small portion of this client's story, and ultimately they have to do the hard work. And so I can be a support for them and encourage them, but they have to be the one to take the action steps to move forward. So a lot of that is just kind of your own cognitive processing of each client's story.
Thank you for answering those questions. And I know we have more. If you're a student or a professional watching today, we have a chat feature. We want you to put your questions to the panel in there. And I'm going to ask Jaron right now to let us know what kind of questions he's seeing in the chat. Jaron?
Yeah, good morning, everyone. This was a very hot topic. It seems like we have a ton of questions in the chat, so we'll hope to get to a lot of them. A few of them are really centered around how do you get started in this kind of a field. And so would you each mind sharing maybe, your best advice for a student that might want to pursue your profession, your certification, your degree? How can they do that? And then there's a few others we might get to along some of those lines.
Sure. So I personally kind of took a similar path as Carmen. I got my bachelor's in social work from Kansas State, and then they didn't offer a master's program in social work at the time. I received that from Washburn University. And then upon graduating, I got work in community mental health, where I obtained my clinical license too, which was about 2.5 years of supervision. I personally came from a background, I grew up in a really small town in rural Kansas. I worked in a nursing home from the time I was 15 years old, and I always knew I had a passion for geriatrics. That was kind of where I wanted to end up. In college, I worked in a nursing home again and worked as a social service worker. And so that's kind of where I found out after a few different changes in my major that social work was the path that I wanted to take and wanted to pursue, just because I knew you could come out with a bachelor's in social work and you could get licensed and you were pretty marketable across a lot of different disciplines, which I think is kind of the enticing feature of social work versus going the psychology route, marriage and family therapy. There's a lot of different avenues though that you can go into to become a clinical behavioral health specialist, not just social work.
Yeah, Cassie and I's credentials are the same. We have the same license. So yeah, I got my bachelor's from Fort Hays University, and then my master's is through KU. Fort Hays has now put in a master's program, so you can do it all through Fort Hays now. I actually was a elementary education major, and I didn't even know social work existed until I was working in that role. I was actually working in the role as a para at a school and kind of had some interactions with social workers. And I was like, oh, okay, like this is speaking more to me than education. And so switched my major from there. And then like Cassie, I worked in a nursing home. I worked for Child Protective Services and kind of figured out kind of where I fit into, and behavioral health just almost fell on my lap. So really kind of, went from there. Mm-hmm. I never really intended to get my clinical license when I graduated with my bachelor's. Mm-hmm. So just kind of came about.
All right, for mine, I'm an advanced practice registered nurse. So any way that you can become a nurse then gets you on to becoming an APRN, or the advanced practice registered nurse. So I started with my BSN out of high school, which is a Bachelor of Science in Nursing. And that's a 4-year degree. There is some, like you can go and get your CNA, you can, or certified nursing assistant, you can become a licensed practical nurse after that. So you can do it in stages. And then they also have what's called an associate's degree for a registered nurse, and that's a 2-year degree. And then there's definitely all kinds of crossover type degrees that you can do, and you can go straight from an associate's degree, registered nurse, which is the 2-year program, and become a BSN, which is the bachelor's, and then move on directly into the nurse practitioner degree. And that's what I started, just with BSN right out of high school, and then went back and got my advanced practice registered nurse degree in family practice. And did that for many years, and did like emergency room call and like primary care provider type things, and then decided that I had a passion for behavioral health and went back and specialized in behavioral health for my degree as an advanced practice registered nurse.
Well, thank you. It sounds like there are many pathways of getting into the behavioral health field. So that's, I think, really helpful for people to hear that. Another question, how much knowledge of the brain do you need to know in order to treat someone? And then are there different ways to help others that have trouble with their behavior and emotions?
For me, you do have to know kind of how the brain works and what the chemicals in the brain, the neurotransmitters, what they actually do and what they work on, and how they influence your behavior and your thoughts and your emotions. And how if you have less of one, more of another, or less of all of them, or whatever levels you have, that how can we affect those neurotransmitters, either by working with therapy, encouraging more self-care, like exercise, diet, those types of things influence that. And or medication, then, which is the piece that I do. So we always try to help people do therapy first. That's my thing, is getting the therapy first. And then if things aren't working well, then we can always add medications as needed. But yes, you definitely need to know what's going on in the brain.
And then another question we got from Kristen. One of you mentioned a nurse helping you. And so Kristen's wondering, how do you work with other medical workers in your environments?
Yeah, so I'll begin. In our program, I think, like we said, we're kind of a specialty program for seniors in our area. We also have an RN on staff, so a registered nurse, who is our program director, and they're required to provide nursing assessments. We do blood pressure checks, we check weights weekly. We work really collaboratively with their primary care physician, sending them an update letter every month while a patient is under our care and in our program, because we do know, like Rama was saying, that mind-body social emotional connection is so great, and there's being more and more studies done about that. So I think it's really important to take that holistic and collaborative approach with patients so that we can get them the best care and service that they need.
Yeah. And Robin and I are both placed in the primary care setting, so we work in the medical clinic. So we are right next to most of our patients' primary care providers. So we have that connection there. With the integrated health, we can also kind of interject. I think in that video it showed, we kind of, if the primary care has a patient in there that is struggling with something, that's a great time for a warm handoff where I can come in and kind of introduce myself, talk about my services, talk about Robin's services, and hopefully connect with that patient while they're in seeing their primary care. So we work very, very closely with the providers and the nurses.
I think it's important to note, though, that there's more and more pathways for RNs to work in psychiatric nursing too. So not just in our program where they can work, a registered nurse can work as a behavioral health specialist, but there's many avenues inpatient, and it's becoming a more and more demanding field. So definitely a good spot of interest for people that want to kind of serve in that capacity.
Definitely.
Great. I'm just gonna say a few more questions in our last couple of minutes. One might be a quick fire one here. For someone who already has a master's degree in public health, what would be the best way to segue into clinical behavioral health? What additional education would you recommend to be the best for this person to pursue?
Really depends on what capacity they want to serve in. If they want to be more on the therapist side, if they want to be more on the medication management side. If they're looking to be more a clinician, you can just kind of look at whatever master's degree you feel like best interests you. It's probably going to be kind of a lateral transfer to getting your master's in psychology or your master's in social work. For us personally, I can only speak from my experience. Getting a master's in social work made the most sense because we could go in at an advanced standing and it was just a one-year program. Yeah. So that was really the advantage of getting a master's in social work for me versus a master's in psychology or licensed professional counselor or something like that. But a lot of those programs are going to be probably a 2-year program if you don't have your undergraduate in an affiliated field, is my experience. Would you guys have any different recommendations?
I would agree.
Okay.
Right. And we'll do 2 more questions. Our second to last one, how often is art and music therapy used in the hospital setting?
Yeah, so we offer nursing groups in our program once a week. Now, my groups are more focused around either psychoeducational, what we call insight-oriented or supportive, but our nurses do provide either art, music, or a psychoeducational group once a week. And so we do like to use that in conjunction because, again, we know the connection between mind, body, that creativity can spark change and really help somebody boost their emotional health. And yeah, Carmen, I know you do.
Yeah, I would say it's every day, right? We use music for grounding techniques. We use art for grounding techniques. We use it in play therapy a lot. So there's constantly music, art, all sorts of things going on in my room anyways. Yeah.
Right. Yeah. Well, I think that's part of self-care too, is finding out, are they interested in music? Do they enjoy listening to their music on a daily basis, and being able to kind of bring that in and use that as a way to help them either express emotions or
it's a tool,
calming. Yeah. as like you said, a grounding technique. So.
Great. And then the last one we have for you all. Someone asked, as experts, what tips do you have for students and others watching today wanting to manage their own mental health?
Get a therapist. I think every person in mental health, any person in even school, right? Like that's stressful. I think getting a therapist, having somebody to talk to, learning those skills early so we can avoid burnout and getting overly stressed. Just having good self-care routines, I think is a good way of managing mental health.
Yes.
Because it is a stressful field. It's stressful, so.
Yeah, and we even do that among ourselves. So, you have somebody that you go, it's kind of like we have our own therapist, right? So we go and talk, I mean, really, because you're having to kind of get it out. Otherwise, you're carrying all of that. So for the student, being able to talk with somebody that's not biased, and able to kind of just listen and then give them some tips, pointers, that kind of thing. And then self-care.